Hello, I'm Dr. Maggie Nolin, a field service veterinarian with Equinext, the company behind this new and innovative soft tissue injury treatment, Novobrace. Before using the product, read the product insert completely and contact us for a consultation to discuss your case. It's a free service and we're committed to your success and your client's success. Today I will show you how to prepare Novobrace for injection. Novobrace is easily reconstituted for injection and once prepared must be used within 1 hour of preparation. First, we gather and prepare our materials. Tuberculin 1 ml syringes, as many as you need for the injection procedure, a 3 ml syringe, and several 22 to 25 gauge needles, non-sterile and sterile gloves, and the Novobrace 2-vial device. The next step is to open all of our supplies onto a sterile area. The sterile glove paper works great, or you can use a metal tray that has been cleaned and disinfected. Once everything is open, we will reconstitute the Novobrace cross-linking solution. We recommend you wear non-sterile gloves for this part because if Novobrace comes in contact with your skin, it will stain it temporarily blue. However, if you do get it on your skin, don't worry, it's harmless and it'll wear off in a few days. Washing with soap and water after contact will reduce the chance of a stain. With your gloves on, use a 3 ml syringe to draw up 2 ml of the clear solution from vial 2. Add this to vial 1 and shake. As you can see, it forms a clear yellow-brownish solution. In any event, do not administer the device until the reconstituted device is in solution without any visible crystals or seen substrate. It's important to note this must be done at room temperature, otherwise the product will not reconstitute. A common example would be an extremely cold region or almost any barn in December. In that instance, we recommend you warm the vials by holding them in your hands or warm them in your truck for a few minutes before combining them. Now, using sterile technique, draw up the desired amount of Novobrace into your syringes. I recommend preparing separate syringes with the amount you will need for injection. For example, today I will be treating a small superficial digital flexor tendon lesion. So I will draw up 3 syringes with 0.2 ml in each syringe. This ensures that I have both the correct amount in each syringe and I will also inject the correct amount. This is essential for the best outcome. Replace the old needles with new needles. I recommend using the smallest needle you're comfortable with. A 22 or a 25 gauge needle works best. Novobrace is now ready for injection into an equine tendon or ligament. Be sure to watch our video demonstrating the injection technique, and remember, if you ever have any questions about the science behind Novobrace or would like guidance regarding the preparation and administration of this exciting new therapy, please feel free to call us or send us an email. Thank you for your time and we're looking forward to hearing from you.